Well, hello, everyone. Thank you for again being here for our updates with regard to what the state is doing to slow the spread of coronavirus here in Nebraska. As always, I will start off with our stay-at-home reminders. We're on day 13 of 21 to stay home, stay healthy, and stay connected. And of course, we've got our rules here, our 6 rules for doing that. First, stay home. Don't take unnecessary trips outside your household. 2, work. But work from home if you can, and if you're going to the workplace, do the appropriate social distancing, like staying 6 feet away from each other. Shop, but shop alone. Go once a week, have a list, be prepared, get in, get out, and don't take the whole family. Then 4, help kids socially distance. Avoid playgrounds and large group sports. 5 is help seniors. Maybe you can run errands for them so they can stay home, or do their shopping for them so they can stay home, but don't go visit them in a nursing home. And then 6 is exercise daily, but do it at home or with an appropriate social distance type exercise. So again, follow our 6 rules to stay home, keep Nebraska healthy. Now, also yesterday I talked about our new testing program called TestNebraska. We have a website up there, TestNebraska.com. And as of this morning, we had just under 20,000 people who had registered. And one of the questions we got was, well, even if I'm not feeling bad, should I go ahead and register? And the answer is yes, please do. This helps us to be able to see what people are interested in maybe getting testing down the road and collecting that data. And if that status changes, you can always go into the profile and update your profile and say, hey, I've got symptoms now, and so forth. And of course, that would bump you up on the list to be able to get tested. But it really helps us at the state get a complete picture of what's going on around the state. So please go get assessed at testnebraska.com. And we've got a little bit of a friendly competition going here with Iowa. Iowa is ahead of us right now with the number of people getting registered, so we can't fall behind Iowa. So please, Nebraskans, go get registered on testnebraska.com. And then once you do, go challenge 5 of your friends to do it. They can use the hashtag TestNebraskaChallenge, and we can use social media, and it's spreading virally on social media to fight the virus here in our state, right? All right, so we can use going viral on social media to fight the virus here in Nebraska. So go out and challenge 5 other people once you've completed the assessment. It takes 5 minutes. The data is kept in an encrypted database. It's only used for the state. It's not sold to anybody. So please go out and get the assessment. Go to testnebraska.com. All right, so getting into our program today. Today is Earth Day, and typically on Earth Day what we do is we recognize one of our farmer ranch families who really demonstrates what the Aldo Leopold Award is named after, Aldo Leopold. He discussed the land ethic, basically understanding that conserving the land was important for the long-term success of agriculture and for our state and just in general as well as our entire country. And our farmers and ranchers were the original conservationists because they wanted to pass on that family farmer ranch to the next generation. And so the Aldo Leopold Award really recognizes those farmers and ranchers who are really living up to that ethic, who are really going above and beyond to be that conservationist, to demonstrate that land ethic. And so normally we would have the farm family here. Today we're announcing it's Ed and Lita Olson from Craig, Nebraska and Burt County. They're going to be receiving a $10,000 check for the work they've done. They'll be receiving that at a later date, and obviously we don't have them here because we're doing all the social distancing, and we got the stay-at-home order, right, or thing going on. So we want them to stay home. We want them to stay healthy. We want them to stay connected. We'll catch up with them later. But the Olsons really have done a fantastic job. They've got about 845 acres. About 115 of those acres are in conservation, so they've got shelter belts, pollinator habitats, filter strips, that sort of thing. In the off-season, they plant cover crops like legumes or grasses to help the soil retain its moisture. They've been using no-till practices on their corn and soybeans for 20 years now. So they really are a great model for how our farmers and ranchers are the original conservationists and looking to take care of that land so they can pass it on to the next generation. And the Aldo Leopold Award is sponsored by the Sandy County Foundation, by Cargill, by NET, and by AFAN. So those are the main sponsors for the award, so we want to thank them for their participation. And this award actually recognizes folks in 21 states, our farmers, ranchers, and foresters. So we're very excited to be able to make that announcement today. Sorry the Olsons can't be here, but we will try and catch up with them at a later date. Next, municipalities. So I have been having weekly calls with the municipalities to talk about the various issues. And we tend to break it up into the different classes of municipalities we have. Over 385 of them are a part of the League of Municipalities and work on a variety of different issues, and especially as we have rolled out these DHMs, they're on the front line of how do you actually implement this. And it's one of the things I talk a lot about when it comes to economic development. I say, you know, nobody comes to Nebraska to a generic place called Nebraska. They go to a specific community. Well, that's the same thing with regard to how these DHMs get implemented. They're not implemented in a generic place called Nebraska. They're implemented in people's hometowns. And it's our mayors and village board members that are the ones that actually have to implement the rules that we put in place. And so we've opened up this line of communication to be able to help them understand what our intent was behind some of the rules that we put out there, and for them to be able to implement that in their communities and communicate with their constituents. So today we've got Lynn Rex, who's the Executive Director of the League of Municipalities, to come up and address some of the issues that we've been talking about with our mayors. You know, it can range from anything with regard to, you know, what is the policy going to be around swimming pools to what are you flushing into your sewers, right? These are all very practical matters about how you actually run our municipalities. So with that, Lynn, I'd like to call you up and say a few words on behalf of our municipalities and some of the issues that they're dealing with.
Thank you, Governor. Really appreciate the great job that the governor has done across the state of Nebraska in educating our municipal officials and others on what they need to do to meet the high priority of trying to stop the spread of COVID-19. This is extremely important, and with municipalities, that is the overriding COVID-19 concern. How to protect citizens, how to protect our first responders, our police officers, our firefighters, and others. For example, in municipalities, municipalities own hospitals, nursing homes, assisted living facilities. We're very concerned about the patients and the clients there. We're also concerned about the workers there and their families. So please keep them in mind every day when you think about the folks that are keeping us safe so that we can be working from home if possible, and those folks that are on the front line and what they're doing for all of us. With that, I have a few issues I'd like to talk about today, and the first one is extremely important because it deals with the leadership that adults need to be providing for kids. This deals with the use of parks and park equipment. So with that, let me just say that one of the things that if you need to sometime decide that you want to get some good rest, look on the CDC website. Lots of information there. And one of the things that you're going to find out is that there are lots of guidelines on the use of parks and park equipment. And I'd like to just review some of those with you. And it's very similar to what the governor talks about every day, which is social distancing, 6 feet. Make sure you're doing that. If you can wear a mask, please do that. Most importantly, if you're sick, don't go to a park. Don't go to a public park. Don't go to a private park. Stay home. And if you're really sick, then you need to call 911 and get assistance. But that being said, when you pull up to a park, if you find that it's crowded, maybe that's not the day you need to be there. In fact, you need to find a different day. The CDC website talks about the fact you should find a park that is close to you, so you don't have to travel a distance and you don't have to stop to get facilities and then have to worry about washing hands, going through all of that. And of course, always try to have some hand sanitizer with you in any event. I'm really proud of the way that some of the Lincolnites have been handling some of this. I live by Holmes Lake, and one of the things that I've noticed is that folks are doing a really good job social distancing, walking, wearing masks, doing that. But every once in a while, you will see something that is very disconcerting, and this gets to the use of playground equipment. This can be very dangerous because the virus and the CDC website and NIH, the National Institute of Health website, will tell you that that virus can be alive, stable, if you will, for up to 2, maybe 3 days on plastic. The playground equipment, almost all of it, is plastic or metal. And even on metal, I was kind of surprised to find out it can even stay alive on metal for that long. And so municipalities are trying really hard to make sure that, first of all, it was signage, putting up signs, so that they could say, look, because of COVID-19, do not have your children on the playground equipment. And it's very disconcerting to find out that that was not enough. Some parents thought it didn't matter. They were going to let their kids do it anyway. And so then municipalities have been basically taking crime, it's really like the yellow crime tape. It almost looks like a crime scene because they're wrapping up the playground equipment. We understand that at least in one municipality, somebody decided to cut the tape so their kid could actually play on the playground equipment, knowing that there was a sign there saying, please don't do this. You know, COVID-19, this virus is there, don't do it. Not just to protect your child, but your family, and of course all of us too. The city of Lincoln has put up kind of orange fencing around their parks, around their playground equipment. Swings are being removed from the swing sets. Folks are really trying hard to protect your kids, and as adults, and even teenagers, if you're taking your younger siblings, make sure that you're setting the example and not doing that, because it really is a safety issue. Dave Boss is the loss control manager for the League Association of Risk Management, and he will soon be our executive director. And one of the things that he said the other day when we were talking about swimming pools and all those kinds of issues that relate to swimming pools was, you know, this is really whether it's parks, swimming pools, you name it, those are wonderful. We love them. We've got great parks in Nebraska, state parks, local parks. And one of the things that we need to keep in mind is that's a quality of life issue. COVID-19 is a quantity of life issue. It's a life or death issue. We need to be cognizant of that, and we need to understand the importance of this. So again, really appreciate those of you that are taking time to comply. Unfortunately, in Omaha, as we know from reading the World Herald, the mayor of Omaha did her job by closing parks when they found out that coaches were taking teams there to practice. And when the governor had the DHM basically saying schools are not going to be in session with students there in school buildings, it was to protect everyone. So you don't have 10 people right next to each other. You don't have kids doing that sort of thing. So in any event, we really appreciate your compliance. And one of the other things I like to talk to you about, and I'm kind of embarrassed I even have to share this with you, but we're having an issue about what you can and cannot flush and what your responsibilities are. So for those of you from the press, these are posters. They're blown up really big. I've got a bunch of them over here because I know you're all going to want to have them and post them in your home. But basically, don't flush these items. This is just common sense. Please don't flush paper towels, moist toilettes, baby wipes, those sorts of things. And there's a personal incentive why you shouldn't do it. Personally, you're going to be responsible for cleaning up a sewage backup in your own home. You're also, in many municipalities, you are responsible for the line that goes from your home to connect to the sewer line. And if that gets plugged up in some municipalities, you will personally pay to dig that up and unplug it. You'll pay someone to do it. I'm sure you won't be doing it yourself. But there's a cost to that. And also, obviously, you're not being a very good neighbor. And there's all kinds of other implications. But what our municipal officials are having to do in many cities, you will go there, and this will be in grocery stores. This will be scattered throughout the municipality so that people are reminded. They're much bigger than this, of course. But people are reminded, please don't do this. And I realize with COVID-19, there's been a toilet paper shortage. I understand the concept. I'm just telling you, please be cognizant of what the implications are. And by the way, almost all municipalities, we have 529 cities and villages, 380 of the 529 are villages. Almost everybody has an ordinance. There are penalty provisions for basically clogging up those municipal pipelines. So again, kind of sad that we're here talking about it today, because there are some really important issues. And I'd just like to close with I think one of the most important issues, which is we have so many Nebraskans that are now unemployed, that have lost their jobs. They're home taking care of loved ones because of COVID-19, or they're in quarantine, or maybe, heaven forbid, that they've actually contracted the disease. And I think it's so important to note that some folks are having trouble even paying their bills. Lash Chaffin is the utilities director and an attorney in our office. He does a great job. And he's written a policy, a moratorium policy, very similar, I'm sure, to what OPPD, LES, and other public utilities have, and private utilities. So with that, he sent that out across the state. Many municipalities have adopted that. If you are having trouble because of COVID-19 paying your bills and your utility bills, water, sewer, electric, gas, please contact your municipality. Don't just show up at City Hall, because some of them are locked because they're concerned about COVID-19. So call, make a contact, and they will get back to you, or someone will be there working remotely and connect with you to tell you, basically tell us how this is COVID-19 related, that you cannot pay your bills. You still owe them, but we will give a moratorium on a payment period. And we will also probably send you something so that you can have a commitment to have a payment plan that works for you down the road. So I think this is such an unprecedented time, and all of us are working hard to be compassionate toward others that are struggling, and we have so many Nebraskans that are. So if you are one of those Nebraskans, do not hesitate to contact City Hall and have that kind of discussion, or your village board. So again, appreciate everybody, what everyone's doing. Really appreciate the governor's leadership. As he said, he meets with municipal officials once a week, maybe every other week now, to talk to our various classes of municipalities and answer their questions. And it has just been phenomenal for our folks all across the state. And I want to say especially in western Nebraska, because that gives them a connection and also keeps them informed in real time. So they're not just hearing from what's happening in Colorado, they're hearing directly from our leader on this important issue. And I also just want to put this out there too, because every once in a while I hear about, oh my gosh, your state does not have, I even get contacted once by one of the national press associations about, oh my gosh, your state doesn't have a shelter-at-home policy. I'm telling you, for my colleagues, some of those states that have a shelter-at-home policy, it's a non-event. Because when they're allowed to have unlimited people at funerals, weddings, everything else, may make people feel good for a while, but it is the spread of COVID-19. And our strategic way, I say ours, the governor's strategic way of rolling this out with the leaders and using UNMC and Dr. Antoine and others, I think this is just extremely important, the way the state of Nebraska has done it and strategically done it so people understand the concepts and are complying. So with that, again, Governor, thank you very much for allowing me to come here. And again, for those of you that want it, we have plenty of these, and feel free to take them. So, and it's also on the alarmpool.org website, and feel free to print them out. And again, please, adults and teenagers with younger siblings, please take advantage of the opportunity to maybe take your brother or sister or your son or daughter, grandkids, for a walk in a park. Socially distancing, no more than 10 people. Please stay off the playground equipment. That is so very important. Thank you very much.
Great, thank you very much, Lynn. Appreciate you coming here. And again, you know, our mayors, our village board members, city council members, they're all dealing with very practical things about how you run their municipality, and especially when you're going through this emergency, there's a lot of questions. So I really appreciate the work that you've done to be able to open up that line of communication so we can be able to get that communication going back and forth. So thanks for being here today. And also, I know we were talking about swimming pools. The Nebraska Department of Environment and Energy has put out, April 15th, put out a guideline with regard to pools and the 10-person rule. And as we update our DHMs, we'll be doing that more on swimming pools as well. I know a lot of people, again, practical thing people are very concerned about. So thank you very much. All right, so we'll go ahead and get into questions now. So from Dave Driesen from the Sioux City Journal, a worker at the Tyson plant in Dakota City died Saturday from COVID-19. Certainly express our condolences to the family there. The first death of the virus in the metro Sioux City. The number of positive tests in Dakota County now exceeds 115. I think it's actually more than that. And all occurring within the last 10 days. The number of cases in neighboring Woodbury County also has spiked in recent days. To what degree is the outbreak linked to the Tyson plant? So I think one of the things that's important to know about our food processors is they're often the largest employer in their communities. But you can't necessarily link it back to the specific place of employment, especially as we're talking about what's going on with our food processors. They've been taking many of the steps to socially distance in an environment that admittedly is very difficult to socially distance. But for example, I believe in Fremont with regard to the poultry facility there, what Lincoln Premium Poultry do is actually almost building tents around some of the individual workers for them to be able to do their job. So they're really taking steps to be able to do that social distancing, taking the temperature of people that is coming into the facility, people wearing masks, sanitizing everything, putting up plexiglass in between workstations and around places where you can eat lunch, so you're almost like eating in a phone booth and that sort of thing. So I know our food processors are working very hard to socially distance. But we also remember that the folks are only there about a third of their day, and they're spending 2/3 of the day outside the facility. And just, for example, one of the spreads of coronavirus in Fremont actually came from somebody who lives in Fremont, but over the Easter holiday went to Grand Island, picked up the virus, and brought it back. So that's an example, again, had nothing to do with any employer, had to do with that community spread. So you can't really link specifically what's going on, separate specifically what's going on in the plant from the community, that really is a complete package. And that's really how we're treating it, again, with regard to trying to do communication, yes, working with the food processors, but also you're going to see more of our communication working on trying to reach the families and make sure there's social distancing at home. And the reason for our Spanish language broadcast last night for our press conference was to really focus on how do we reach out to communities where English is not the first language. So we've got to continue to work on doing a better job on that, and that's what we'll continue to do as well. But we need folks to be able to do social distancing, the whole time, not just when they're at work, but also when they're at home. Grant Schulte, Associated Press. Utah recently purchased 200,000 treatments of hydroxychloroquine. Has Nebraska bought any? And we have not, so I'm not going to go into the rest of your questions because they were all related whether or not we've done that. Again, that's a treatment that I believe is being tested, though I can't give you any specifics about where it's being tested. I've just read some news reports that said it may be being tested around the country. I know that we do have some tests going on at UNMC with regard to antiviral treatments, but I'd refer you to them with regard to what those are because I'm not familiar with the specifics. And then anyway, but it's just being tested. It's not a proven, to be effective, though anecdotally there are people who it may have helped. It is one of those things that still has to go through testing. Nick Montenegro, sorry, Nick, for butchering your name there, KETV, with the planned easing of some directed health measures, where does that leave business like salons? Will they be allowed to reopen May 4th as well, or will they have to wait longer? We are working right now on the updated directed health measures for Douglas, Sarpy, and Cass. Theirs expires April 30th. Obviously, we've got Lancaster and some other counties that go May 6th and some other counties May 11th. So our team is working with regard to getting those updated for what we will be doing in May. So I would say stay tuned. We're still working through that process with the various parties that are concerned. Dave Schroeder, KRVN. On dental services, what kind of discussions are taking place that would lead to initial step of reopening dental offices? For example, any opening date and under what conditions would the dental offices be open? So dental offices are covered by the announcement we made earlier this week with regard to elective surgery. So when we prohibited elective surgeries, we included dental offices and veterinarian services in that. And when we announced that May 4th, hospitals will be able to do elective surgeries, that also includes dental offices will be able to open starting May 4th. So now, I believe the Dental Association is working on guidelines for how to do that. Obviously, dental offices are already familiar with how to take precautions with regard to operating and keeping people safe for both people who are working there as well as their customers. And the Dental Association is working on some additional guidelines under this pandemic for dentists as well. So I would say, stay tuned for that. And again, you'll see some changes for how those dental offices open and under what they'll have to do to be able to be open safely. From Reese Ristow at the Omaha World Herald, what percentage of the state's population would you ultimately like to test? Would the goal be 100%? So we have purchased 540,000 tests, so you can get the idea that's about a quarter of the population through our TestNebraska program, plus on top of what we're already doing. It is not necessary to test 100% of people. What we really want to do, and again, if you want to think about this, what we've done to slow the spread of virus here in Nebraska is quarantine the entire state. What we want to transition to is really focusing on the people who are impacted by the virus. Now, TestNebraska will help us do the assessment on folks, and as people are symptomatic, we will be able to ramp up the testing to be able to get to those folks. And really, ultimately, we want to test asymptomatic people as well, because we know that you can be asymptomatic while having the virus, but it also gives us an idea of how many people in the state are impacted by it. But ultimately, what we want to do is go from quarantining the entire state through our DHMs to focusing on quarantining the people who are impacted by coronavirus. So through the testing program, discover the people who test positive, get them isolated, and then go back and do the contact tracing so that we can find out who they've been associated with over the course, say, the last couple of weeks, and get those folks to quarantine as well. So that's when we talk about assessment, test, tracking or tracing are kind of the same thing. We're talking about folks doing the assessment on TestNebraska.com. And again, folks, we can't fall behind Iowa, so go out, TestNebraska.com, do the challenge, hashtag TestNebraska challenge. So go out and get assessed. Then as we ramp up testing, we'll use that as part of how we're going to plan our testing to ramp up to those 3,000 tests a day. And then for folks that we discover are positive, we'll do the tracing or the tracking so that we can go back to everybody they've been in contact with and say, hey, you ought to be quarantining because you've been exposed. And that way we can shift from quarantining the entire state to really focusing on quarantining the people who've been directly exposed. So that's our plan, and that's how it's going to work. So again, not necessary to do 100%. Taylor Gage. Taylor, do you have questions that were texted in?
Yes, Alexander Stone has two questions. One is, what kind of tests will be used in the TestNebraska challenge? Are they the quick tests that are not as accurate?
Alexander Stone has two questions. First of all, what kind of tests will be used in the TestNebraska program? So we're going to be setting up a PCR machine. That's the polymerase chain reaction machine. This is the one that tests the antigen. It is not the fast test. It still will take about 24, 48 hours to get those tests processed and turned around. But then we'll be able, again, because we've got your information on the TestNebraska website, we'll be able to respond directly back to you with what the results of those tests are.
She also asks, are state dollars or CARES Act dollars being used for this?
And then the question was, are state dollars or CARES Act dollars being used for that? CARES Act being the federal dollars, and we're going to be using the federal dollars to be able to pay for this.
Julie Anderson from the World Herald says that the Washington Post reported that testing by the CDC is being done in Nebraska nursing homes, looking for asymptomatic cases. Have we heard about this? Where is it taking place? And are we getting some of the contact tracers from the CDC here?
So the question was, Julie Anderson from the Omaha World Herald has read in a Washington Post story that the CDC was doing testing here in nursing homes in Nebraska, looking for asymptomatic people. That may be happening. I'm not saying it's not happening, but I am unfamiliar with that. It has not come up on any of our daily calls that the CDC is doing that. But having said that, I know the CDC has also been here, in other ways where they don't inform me and gone to food processing plants and so forth. So it may be happening, but nobody's told me that it's happening.
William Padmore with Callahan says that North Sioux City says it's going to hold a dirt racing event with 700 people. Are we concerned about a public event of that size so close to Nebraska?
So Bill Padmore says that North Sioux City is planning on holding an event with 700 people at a racing event. And are we concerned about a racing event with 700 people so close to Nebraska? This is the first I've heard of it, so we'll have to dig into it and kind of find out what's all going on and make sure we know all the facts and circumstances.
Kristen Whitman from Fox 42 Omaha has three questions about the test assessment data. She wants to know if we know when the
So
test...
Kristen Whitman, Fox 42, three questions.
When will the data collected from the assessment be destroyed? Are there policies around that? And what can you tell people that are concerned about data mining?
So the question was about the data that we have. We talked about this yesterday. The data will be kept in an encrypted database, that it will only be for state use, so none of the data will be sold to anybody or anything like that. And at the current time, we haven't made plans for how that data will be destroyed because we expect to be using that data for at least the balance of this year. So as this is a program we're just getting up and running, and we don't know about how the virus will continue to spread in our state over the next couple weeks, much less the rest of the year, we really haven't made any plans to be able to destroy that data. But you can be assured that anybody who fills that out, I put my information in there. Your information is going to be secure. It's going to be encrypted. It's not going to be sold off to be used by anybody. It's only going to be used for the state purposes of helping us plan how do we do our response back for the coronavirus. And then, again, prioritizing people who are going to get the testing as we get the testing up and running.
David Earl from KT wants to know if CARES Act money will be going to cities, and do you believe the federal government needs to work on a rescue deal for cities?
So the question was, from David Carroll, is any of the CARES money going to go to cities? I think it's important to note that specifically with regard to the CARES Act, that federal act that the Congress put together, that that cannot go to fill any budget hole, whether it's a state, county, city. So that can't be used for anything like that. It can only be used with regard to how are fighting the virus. So with regard to maybe going to cities, that may certainly be a potential. We're waiting on CDC guidelines to be able to know how that could happen. And the second part of the question was?
Do you think that the feds need to do a bailout for
Oh, and should the feds do a bailout with regard to states? I think maybe a better solution would be actually taking the money that they've given us already and allow us to have more flexibility with that might be the way to be able to go rather than creating a whole new other budget with a whole bunch of other more spending.
Jackie from KNOP wants to know, there's the IHME model is suggesting that states may need to wait more than a month before businesses can return to normal operations. What do you think of that?
So, I'm sorry, who is asking that question? Jackie KNOV is asking, hey, the IHME model is suggesting states may need to wait more than a month with regard to when they can start reopening. And I think we should remember, and this is one of the things Dr. Ali Khan said on one of our NET broadcasts, models such as the IHME one are not predictive. They're just to help you think about how you want to respond to the virus. And what we have to do here in Nebraska is put together a plan that is appropriate for Nebraska. And that's what we're doing. We're putting together a plan that we rolled out the restrictions, not all at once in a statewide basis, but tried to tailor it to different sections of the state as we saw that community spread. We're going to do the same thing as we think about loosening some of these restrictions and doing it in a way that makes sense for Nebraska based upon the data we have about how the virus is spreading and specifically about how it's impacting our healthcare system. At the end of the day, this is all about making sure that any person who needs to have a hospital bed, an intensive care unit bed, or a ventilator can get access to it when they need it. And so that's what all of our planning is about, is making sure that we have that access for that person when they need it. And we've been able to manage it to do that. And so when we think about, for example, the elective surgeries and how we said hospitals can start doing that May 4th, we said you can do that, but you have to have 30% of your hospital beds available, 30% of your ICU beds available, 30% of your ventilators available, and 2 weeks worth of PPE, that personal protective equipment, on site. And if you've met those criteria, then you can do elective surgeries. And again, what that really gets at to is then, do you have the capability to handle people coming in who need that hospital bed because they've got coronavirus? So that's the way we're going to continue to manage it. Again, IHME is a model. There's other models out there, like Dr. Khan's put together a model. But as Dr. Khan himself will tell you, it's not predictive. It's a way to think about how you want to respond to the virus.
Brian from WWT says, with dentists expecting to resume operations on May 4th, what can you say to patients who are concerned?
So Brian from WWT says, hey, with dentists set to be able to open on May 4th, what can you say to people who may be concerned? I'd say reach out to your dentist and talk to them about what steps they're taking personally. As I mentioned, the Dental Association is going to be putting out guidelines with regard to how dentists should operate. I think contact your dentist. You're going to have to call them anyway, right, to make that appointment. Just ask them to walk through what they're planning on doing to be able to make sure that you're staying safe and the hygienist is staying safe.
That's all I have for now.
All right, great. So, questions from in-house here. Martha.
Governor, you said often, in fact, you just said a couple minutes ago, that the goal is to keep from overwhelming the healthcare system. Why isn't the goal to minimize death and serious illness? We're seeing, as of yesterday, 42 deaths in the state. The number is going up significantly. We have almost as many deaths in Hall County as we have in Douglas County, which probably reflects the outbreak in Hall County. Why isn't that your goal?
So the question from Martha is, well, you've talked about how the goal is to preserve the hospital space, but why isn't it about minimizing the number of deaths, for example? And the answer is because this is a virus. We can't stop the virus from coming. It's like the flu. We have a flu season every year, and none of us has any immunity to this virus. So we can't stop the virus from coming, but what we can do is make sure that anybody gets the virus can be able to get that hospital room, that ICU room, or that ventilator. And in fact, if you talk to this with our experts like, say, Dr. Lawler, who was one of the people who advised us on this, or Dr. Cradaville, or anybody else, what they'll tell you is what they've told you, right? What have they all told us? We're about flattening the curve. We're about taking that peak down and spreading it out. But they'll also tell you it doesn't necessarily change the area underneath that curve. And what they mean by that is it doesn't necessarily mean that fewer people will get the disease. What it means is that you will spread that out over time so that the people who do get it can get that hospital care. That's what we can control. We can control how many people get it so that we can make sure we can take care of them once they get to the hospital. But again, this is a virus that we cannot stop because it's a virus, just like the flu. If we could stop the flu, we would have stopped the flu. But we can only take steps to mitigate the flu, and that's only, partially successful based on the vaccinations we have. At the end of the day, what we can control, though, is make sure that everybody who does get this can get that hospital room, get that ventilator, get that ICU room.
But you can with the flu
So the question was, well, there are some ways that you can prevent the flu, like vaccinations or antiviral drugs. And the fact of the matter is, there aren't any of those right now for the coronavirus. So the kinds of steps you could take during flu season, which again, aren't 100%, right? People still get the flu. And by the way, we have people die from the flu every year in this country. The 17-18 year, 60,000 people died of the flu in this country, which is still way more than have died of coronavirus in our country to this point. So again, we can't stop things like viruses from happening until we can start mitigating them with things like vaccinations, and even those aren't going to be 100%. What we can do, though, is make sure that everybody who gets the disease can be treated in a hospital bed, in an ICU bed, with a ventilator, if that's what they need. That's what we can control, and that's what we're focused on.
Question for Lynn Rex.
Lynn, you're up.
Yes.
You said that somebody in your office had drafted a policy on utility shutoffs, but is that voluntary for municipalities, and what percentage of the state's population lives in a place where they are exempt from utility shutoffs?
The question was basically someone from the league office. His name is Lash Chaffin. He's a lawyer. He's the head of our utilities section and our utilities section director. And your question was, when he sent out the policy, how many municipalities have adopted it? What percentage of Nebraska's population does that cover? The latter part I can't answer. What I can tell you is that Lash has received feedback that many of our municipalities have in fact adopted it. And our folks are being extremely compassionate toward those who are unable to pay their bills. In addition, and I'm not an expert on the SBA programs, but Fred, I do know that there are a number of programs that individuals can access, and certainly the unemployment comp system, lots of ways in which they can access to get additional funds if they want to do that. But there are some people that are literally so strapped they can't make those payments, and municipalities across the state are being very compassionate toward them, and should be.
Well, it's up to the individual.
It is. It is not a mandate. Yes. And I think one thing that speaks well of our cities and villages is that if there were complaints, we would be hearing them. And we have not been receiving complaints from citizens or others. But thank you for the question.
We have a question from
Okay, before you get to that, Taylor, and I would just echo, no, go ahead, Lynn, you're good. I would just echo, and certainly we may have, typically we would hear in our office as well, and I don't recall seeing anything coming across my desk or anybody making me aware that people are concerned because they were getting their utility shut off. So I would echo that. I think the municipality is doing a great job in working with people. And I've got, of course, also just remind everybody, even if the municipality is not cutting off your utilities, you still will owe that bill at some point. So this is not a get out of paying the bill card. It is a, hey, we're deferring the payment until we get the economy back up and running and you get your job back and that sort of thing. Taylor.
Mona from the Custer County Chief asked, if someone registers on TestNebraska, how will they be contacted and how do they know the contact is real?
Mona on Custer County Chief asks, hey, if somebody registers on the website and how we're going to contact them, typically we're collecting your phone number and that also, I believe, email address as well. Yeah, we're collecting email address. So we'll probably reach out to you one of those two ways to be able to schedule an appointment for you. And so that's how you'll know it's real. If we're scheduling an appointment for you, we're not going to be asking money. You're not going to have to pay for anything. So if anybody says they're with TestNebraska and they want money from you, do not give them any money. It's not about money. All this is free. It's being paid for by the state. What they will do is just contact you to be able to schedule an appointment to come in and get tested, and then respond back to you with what the test results are, and I believe that will be by email. Do you have anything else there, Taylor?
Jim at KTV wants to know if you've worn a mask.
Jim at KETV wants to know if I have worn a mask. I have worn a mask in certain situations, but typically my job involves communication, so I am typically not wearing a mask when I'm here talking to folks. Is that it? Okay. Other questions for him? Yeah.
For the TestNebraska, you said the goal is to quarantine people as opposed to the DHM to quarantine the state. Could you take it a step further and say the amount of people who fill out the assessments could have a direct impact on how quickly restrictions get lifted as opposed to if less people could take longer?
So the question was, will the amount of people who register to get assessed on TestNebraska directly relate back to the DHMs? In an indirect way, that's probably true, because the more that we can do The more that we can collect data with regard to what's going on in the state, that will help us make better decisions. And of course, we're going to make decisions based upon being conservative with regard to the healthcare system. So again, we're going to be looking at how many hospital beds are being used, and so forth. So again, if you look today in the state, we're doing very well. Over 40% of the hospital beds are vacant. Over, I think it's 46% of the ICU beds are available. 76% of the ventilators are available in the state. So we have a lot of capacity right now in the state of Nebraska, and that's because we were very conservative with regard to these DHMs that we put in place, over a month ago now. So if we got more and better data, that will allow us to make better decisions about how we roll out those DHMs. Yeah.
Governor,
Hey.
we just had a couple people message us today asking when they're gonna get unemployment checks. So they've been waiting 5 to 6 weeks now. Do you know when they might get those?
So again, the question was, people are emailing saying, hey, when am I going to get my unemployment check? And again, the system has been such that we have had so many people register, more than we've had in the last couple of years combined, that we're working to get those through as quickly as possible. The goal we have is to get 75% of those done between 21 and 28 days. So if we discover that maybe something's not been done properly, I know we had some issues where we had some unemployment folks were not getting processed. We're working on getting on that and fixing that and getting it out the door. But I would say just the other thing is a lot of patience, because we're going through a lot of these applications. I know it's tough and people need those checks. We're trying to do the best job we can. We're bringing on more people to be able to do it. We've contracted to bring on an additional 150 people from outside state government to help us be adjudicators to get these processed. But it is going to take time, and I would note that some states like Connecticut are taking 40 days. Their target's 40 days to get these checks out. Yeah, Fred.
Governor, when you started talking about quarantines early on, it was for people who had traveled to out-of-state spots that are hot spots, people that had been exposed to somebody, people that maybe had symptoms. Now you're saying the whole state is quarantined. Can you explain the difference in terminology there?
Oh, so when Fred asked, I've said the whole state's quarantined. I guess what I'm using is just kind of a broad analogy. If you think about it, when we do a statewide DHM, like the 10-person rule, that's that's a kind of a quarantine on the entire state. Everybody's got to obey that. What we want to do is really focus that down and loosen up those broad restrictions to really focus more specifically on the people who've been directly impacted. And again, it gets back to really focusing as we can do more testing and as we broaden this out, we'll have better data to be able to do that will allow us to actually focus in more on the people who are specifically been impacted. So I guess I use that as a broad analogy if you want to think about that 10-person rule that's statewide here in the state. Lee.
A week ago or a few weeks ago, I don't know at this point, you had talked about how health departments are putting applications for PPE that was to be distributed. Do you have any updates on how much you guys have obtained and how much has been distributed, and the number of people that you just said we don't have enough for?
So the question was, we've been working on PPE, health departments have been getting it distributed. Where are we with regard to that? Do I have any numbers? I don't have any numbers off the top of my head. I know that we have been receiving things like N95 masks and surgical masks, and we've got millions of gloves and all that sort of stuff. But we can get that data for you and get that out to you. There's daily calls with regard to all the public health districts, and when people are running short on PPE, they can flag it on that call. We also, get daily updates on how many people are requesting PPE and so forth. So, but as far as what we've actually distributed, I don't know off the top of my head, but Taylor can take that as a to-do to follow up with you with regard to what that number is.
But there is that process happening actively where health departments are in application and you guys are in distribution.
Yeah, absolutely. So the process itself is very active where health departments make requests to us and we distribute out to them. Martha.
Since yesterday, have there been any plans made for assessment and testing of people who do not have access to a computer, internet, smartphone?
So the question was, the issue was surfaced yesterday that if I don't have access to the internet or the smartphone, or if I don't have an email address, how am I going to be able to get tested? And since yesterday, have we put any plans in place? And the answer is no. Again, that issue just surfaced yesterday. Again, we're not trying to let the perfect be the enemy of the good here. We still got, 20,000 people out of a state of 1.934 million, access the site as of this morning. So We still got lots of potential out there for people who do have access to those things to be able to get on the assessment. It's gonna be 10 days before we actually even get testing up and running. So we're gonna be looking at some of those alternatives, but we didn't want the perfect to be the enemy of the good here. We wanted to get something out that, an 80% solution to be able to help people get on board. That's what we wanted to focus on rather than waiting for a perfect answer. And by the way, if you've got, again, if you don't have internet access and you're one of the folks who may be symptomatic, or you present to a hospital, or you've been exposed, you're still got access to the testing that we do through our regular testing. So nobody is being harmed by this, because right now, we're testing anybody, whether you've got internet access or not, and that's still available. That's not changed, that part's not changed. This is kind of a testing program on top of that.
But doesn't this run the risk that you miss a particular group of people, because there would be the folks, the low-income folks who can't afford this, perhaps some of the immigrant communities, perhaps some of those meatpacking workers?
So the question was, is there a risk you miss some people with this? And I think, yeah, there is a risk that we miss some people until we have that solution to be able to do it by another system besides just using the website to be able to do it. But again, that's where we have alternative members, other ways to test people, currently using the Public Health Lab or UNMC. And then we're also exploring other ways to get testing too. So on Monday, the federal government gave us a list of all the labs here in the state with all the machines that might be able to be used for testing coronavirus. The Department of Health is right now following up with that to see what we might be able to do. So there are other alternatives out there. Again, not that we want to ignore looking at another solution, but we wanted to get a solution that would work for the majority of people out there, because that's still more of a benefit to us than doing nothing at all. Yeah, Lee.
In yesterday's press conference, we talked about how Utah is kind of the inaugural place that has kickstarted this. Do you know if those locations had applications for their workers at their pop-up tents, I'm gonna call them, across the state? Or you said National Guard would kind of be facilitating early on, but who are the core workers that will be working across the state to kind of facilitate that operation?
So the question was, as we roll out the testing, who are going to be those core workers? And as I mentioned yesterday, we'd probably get the first tent up and running with the National Guard, because we've got them readily available. But then we'll have to go do our staffing to staff up those pop-up tents that will travel around the state and do that testing. So we'll have to develop our own organization to do that, and we're in the process of setting that up. Yeah, Lee, go ahead.
Another follow-up on that. In the next 10 days, 9 days now, I guess this point you could say, is when you're anticipating that process to start. Are you going to be asking for local health departments to say, we can use one here, or who's making that decision of, this is where one needs to be placed and this is another area kind of thing?
So the question was, when we start doing testing, how are we going to make those decisions on where we're going to do the testing? And we'll put together an entire testing plan, and part of it, frankly, will be driven by people filling out the assessment. So if you are interested in having increased testing in your area, that's another good reason why you should go and fill out that assessment, because the more data we have from specific areas, that will help us determine where we want to do that additional testing as we go around the state. And as I mentioned, again, what we're going to focus on first, our top priority is going to be people who are protecting us. No different from when we started out with this, but it'll be, our healthcare workers, first responders, police, firefighters, EMTs, and so forth. Then highly symptomatic people, and then we'll roll into less symptomatic people, and then as we have capacity, asymptomatic people, so that we can get a broad section of data with regard to how is the virus spreading in our state, where is it heavy, concentrated, how is it impacting people. So again, if you think you want to have this testing in your area, it's another great reason to go ahead and go to TestNebraska.com and fill out the assessment.
Time for a couple more questions.
2 more questions. Yeah, go ahead.
Another one then. You talked maybe last week about the SBA or I'm confused.
SBA. Well, I did talk about the SBA.
Okay, but in regards to the Congress passing a new round of SBA funding, has there been any progress made that you know of in terms of reapplication, or if that has even been?
So the question was, with regard to the SBA, has there been any progress with regard to whether people will have to reapply, will their old applications count? And I don't know the answer to that. Taylor, did we get an answer back from the Banking Association on that?
No, we probably won't know until the bill's signed by.
Again, we probably won't know until the bill's signed by Congress to know the exact details of the law, so that's probably up to Congress to be able to make that determination, so Don't have an answer for you on that one yet. Okay, last question, Martha.
Yes, the announcement you made earlier about elective surgeries, have you put out an actual directive or order on that yet?
Okay.
If not, when will you do that?
So the question was, with regard to our announcement, with regard to elective surgeries, beginning again on May 4th, have we issued a directed health measure? Dr. Antone, I don't believe we've done that yet. It's still in progress, but obviously we will do that before the May 4th timeline. So I don't have an exact date to give you, but we will be doing a new directed health measure specifically around that. However, right now, almost everybody knows, as Dr. Antone informs me. Well, again, I kind of gave you the broad guidelines, and then as far as how specific hospitals implement that, so the 30, 30, 30 plus 2 weeks of PPE, that's not going to change with regard to our guidelines on those elective surgeries. But hospitals have their own guidelines and will be developing their own guidelines with regard to how they will roll that out or implement it. So, for example, which elective surgeries or which patients they will take first and prioritize, or how many of those they will do. The hospital systems themselves will work on those guidelines. All right, folks, again, thank you very much. Appreciate everybody coming in this afternoon. We'll see you back here at 2 o'clock tomorrow. And remember, 5 p.m. tomorrow, we will have the Spanish press conference again. And then on Thursday night, tomorrow night, 8:30, 9:30, NET will be there. Thank you all very much. And again, I just want to say thanks to all the Nebraskans who are working to slow the spread of coronavirus here in our state. We'll see you tomorrow. Thanks. Thank you, Francis.